SpO2 scale 1 and 2. Oxygen saturations, SpO2. Two scoring scales are present on the news chart for recording oxygen saturations. By far, most patients will use scale 1. Scale 2 is only being used for patients with hypercapnia, respiratory failure. Scale 1. The SpO2 scoring system applies to the majority of patients you will ever meet in the OSCE, even with respiratory problems that may appear severe and patients that appear they are struggling. Pulse oximetry is routinely used in the acute clinical setting. It is a non-invasive measurement of oxygen saturation. A plus B, SpO2 scale 1, oxygen saturation percentage. SpO2 scale 2, oxygen saturation percentage. Use scale 2 if target range is 88 to 92%, for example, in hypercapnic respiratory failure. Only use scale 2 under the direction of a qualified clinician. Scale 2. This is a dedicated SpO2 scoring system for patients with hypercapnia respiratory failure. The desired oxygen saturations for them are set at a lower level, 88% to 92%. This means the new scoring system is adjusted accordingly. The SpO2 scoring scale 2 is for patients with a prescribed oxygen saturation requirement of 88 to 92%, for example, in patients with hypercapnic respiratory failure. This should only be used if patients are confirmed to have hypercapnic respiratory failure on blood gas analysis or either a prior or their current hospital admission. The decision to use the new SpO2 scoring scale 2 should be made by a competent clinical decision maker, that is a doctor or nurse practitioner, and should be recorded in the patient's clinical notes. In all other circumstances, the regular news SpO2 scoring scale, scale 1, must be used. For the avoidance of doubt, the SpO2 scoring scale not being used should be crossed out across the chart.